Cardiac output is the master number for blood flow. It's the total amount of blood pushed out by each ventricle per minute. And this number is what determines how much oxygen and nutrients are getting delivered to literally every cell in your body. Okay, so if cardiac output is the big picture, the flow per minute, then stroke volume is the smaller but equally important part. This is the specific amount of blood that gets ejected with each individual pump, each heartbeat. Think of it as the volume per stroke. So where does this stroke volume number even come from? Well, it's actually just some simple subtraction. The ventricle fills all the way up with blood, that's its end diastolic volume. Then it contracts, whoosh, but it doesn't empty completely. The little bit of blood that's left over, that's the end systolic volume. So the stroke volume is just what you started with minus what was left. And we measure the efficiency of that pump with the ejection fraction. A healthy heart pushes out about 65% of the blood it receives with each beat. It has a built-in feature to adjust its output on the fly, and this is all thanks to a fundamental principle of physiology, the Frank-Starling law. I know, the official wording sounds a little dense, but the idea behind it is incredibly simple and intuitive. We know cardiac output is a huge deal, and we know it changes, so how do doctors actually get a number on it from a patient? And now we have amazing non-invasive tools like Doppler echocardiography, which uses ultrasound to literally watch the blood flowing and measure it directly. In an emergency room for a patient with severe trauma or a massive infection, how could tracking this one single number, the output of the body's engine, guide every decision you make, from giving fluids to choosing medications, and maybe even save their life?